Being dispatched for a patient report of having a seizure. Given the nature of the call, trauma may be involved. When arriving upon the scene, seeing the safe, PPs are on. Gonna call ALS backup. ALS is en route. I do see a young man, 24, from dispatch report, who appears to be lying unresponsive. There's also a bystander. Excuse me, ma'am. Do you know the patient? Yes, it's my boyfriend. Can you tell me what happened, what led to these events? About 10 minutes ago, my boyfriend and I were having an argument and he began having a seizure. It usually stops after a minute, but not this time. He told her to take his medication, but he doesn't listen. Can you help us? Okay, yes, ma'am. Sir, can you hear me? Patient's unresponsive, breathing, doesn't respond to pain. I'm going to administer C-spine from chin to neck. C-spine secured. Place patient head on the pillow. Assess patient airway. Airway is patent. No secretion, free and clear. Okay. Breathing. "20 breaths per minute. Tachypnea. Signs of poor perfusion. Patient's skin is diaphoretic. I'm going to go ahead and check for gag reflex. OPA from earlobe to chin. Side of mouth. Patient accept. Bag patient. None. Breathing mask. 15 liters of oxygen. Begin bagging at 10 to 12 breaths per minute. Patient's being bagged. I'm going to go ahead and get some further information concerning patient medical history. You did say he has seizures history. Anything else? Yes, he does have a TBI from an accident that he suffered years ago. Any allergies? No, none that I could think of. Okay. I'm going to do a head-to-toe assessment. No paralysis at this time. Patient, normal movement. No speech. Patient's head. No signs of trauma. No bleeding from the ears. Nose, no bleeding. This tells me that there's no trauma, no extra blood on the brain. Pupils, even size. Neck, within normal. I do see signs of trismus, meaning jaw neck. Assessing the patient from head to toe. Chest, within normal, no signs of trauma to the chest. EBI, GU, signs of incontinence, which is consistent with seizure. Upper extremity, lower extremities. I do see signs of tremors, posturing. I'm going to record the time that it starts. 7 to 8 minutes. Seizure stop. Record the time. Going to go ahead and take patient's vitals at this time. Patient's blood pressure is 142/82. Respiration. Tachypnea still. Heart rate. (130). Tachycardia. Poor perfusion. Still diaphoresis. Blood glucose level. It's a normal range. I'm going to go ahead and load the patient onto ambulance. No lights or siren. Patient's loaded onto ambulance. I'm going to assess the patient. Next 5 minutes, reassess patient for vital signs. While en route, go ahead. 5 minutes. Patient level of consciousness now. V times 1. Blood pressure. 130/80. Patient's heart rate. 80. Respiration. Decreased 10. No signs of pain. Patient's temperature, 96. I'm going to continue checking airway. Patient's breathing. Circulation. Patient now is in a popsicle stick. There's signs of patient consciousness. Patient responding to pain. Ow. Continuing with bagging patient at 15 liters of oxygen this time while en route. Once again, no siren, no lights to exacerbate the situation. 5 minutes later, patient start, reassess patient, deconditioning patient status, respirations drop to 0, level of consciousness decrease, patient's heart rate 140. Arriving at hospital, I'm gonna have my patient partner go ahead and call in the report as I continue to reassess the patient. Radio unit, unit 1, ready for report. Radio unit 1, responding to residence home in Gallup for patient Mr. R, was found unresponsive, having a seizure episode. Appears to be a grand mal seizure. Patient was unconscious, lying on the ground. Patient was administered high flow oxygen at 15 liters via breathing mask. There was no epileptic static. Bystander stated that there was no signs of aurea. Patient was incontinent. Patient started to improve 5 minutes after ventilation and vital signs was assessed with 15 liters of oxygen. Patient's GS status improved from 6 to 12. Patient's currently now as apneic and posturing. Are there any questions at this time or any orders for me? We will see you in the next 2 minutes. End of report. I don't know.